Hi everyone, welcome to another one of our bite-sized education sessions. My name is Kerry, I'm a continence nurse and I work here at the Victorian Continence Resource Centre. And today I want to talk about catheters. So what is a catheter? Well, basically it's a thin hollow tube that drains something, and of course I'm interested today to talk about urinary catheters because they drain urine from the bladder. And there's two basic types of catheters, and the first one I'm only going to talk about briefly, and it's an intermittent catheter, and that's what this looks like. So this is a female length. So there are some people in the community who will insert this catheter through the urethra, or the tube draining the urine, into their bladder. They'll drain the urine out and then they'll remove the catheter and they dispose of it, and then they do it again in a few hours time. But the catheters that I really want to talk about today are the permanent catheters, or the indwelling catheters, and these are the catheters that remain in draining urine from the bladder 24 hours a day. And I have some here. Now there's two basic lengths. So this is a female length catheter. It's around 20 centimeters long, and the female urethra is around 3 to 5 centimeters, so there's plenty of length here. Then we have the male length catheter, and that's this one here, and it's around 40 centimeters long, and of course the male urethra is around 18 to 22 centimeters long. And you don't see many female length catheters in the community. Most men and women will have a male length catheter. Now there's different materials that catheters are made of, as you can see here. So this clear one is 100% silicone. Whereas this other catheter here, this yellowy brown, it's a latex catheter that's coated with a special coating, and you see these very commonly used in the community, obviously not for someone who has a latex allergy. Now with catheters, I'm going to show you how when they go into the bladder. So we're going to pretend this is my bladder neck here and this is part of my urethra. So what actually stops the catheter from falling out of the bladder? So I need to inflate the balloon. There's a balloon here at the end of the catheter. So there's drain holes here on either side, and that's where the urine drains out through the catheter and into the drainage bag that connects into here, but that's a whole other education session. So I'm just going to inflate this balloon, and you'll be able to see as it inflates. Typically we inflate this with sterile water when we insert the catheter. So that balloon sits there in the bladder neck and it holds it in place. It stops it from falling out. And of course the catheter will be fixed to the leg, which is another bite-sized education session to come. These catheters can be pulled out even with the balloon inflated if you use a lot of force, but hopefully that won't happen if the catheter is fixed appropriately. Now the catheter can go in either through the urethra or through the tummy. So here's looking at my male pelvis side on, and here's a catheter going in up through the tip of the penis, up through the long urethra, and it's sitting in the bladder, and the balloon is inflated to stop it from falling out. Now keep in mind, these models aren't life size, so this balloon looks very large in this bladder, but this bladder is not a normal human size. These types of catheters shouldn't be long-term or permanent. They're fine for, a few weeks, but if someone's going to have a catheter ongoing, then they really should have a suprapubic catheter. And the reason is this balloon here can damage the neck of the bladder, and people can even have leaking, which you don't want. So a suprapubic catheter, and I've got one here. Supra means above, pubic is the pubic bone. So here's the pubic bone here. This is a female pelvis side on. So they make a small little hole in the skin of the tummy, or the abdominal wall above the pubic bone, and the catheter goes into the bladder. Now this is a very small size bladder, so it really doesn't look like it fits in properly, but in human beings it sits there quite well and it drains the urine out. So for more information around catheter fixation or drain bags, please look at our other education sessions online. Thank you.